Have you ever noticed a loved one suddenly losing weight without trying? Or perhaps they've become unusually tired, skipping meals or seeming off in ways you can't quite explain. What if I told you these aren't just signs of getting older? They may be your body's way of quietly signaling something much deeper. In this video, we're uncovering the 5 subtle yet powerful signs that often appear in the final year of life, and why recognizing them early could change everything. Most people don't talk about what really happens as the body prepares to shut down. But being informed can make the difference between confusion and clarity, between feeling helpless and having the chance to provide comfort, dignity, and love when it matters most. You're not just going to hear a list of symptoms, you'll gain insight into why they happen, what they really mean, and how to respond with care, not fear. From sudden fatigue and cognitive shifts to appetite loss and changes in breathing, each sign is a quiet message from the body, and learning to interpret them can help you show up with more peace, presence, and compassion. Whether you're a caregiver, a family member, or just someone wanting to better understand this deeply human experience, you're in the right place. So if you felt overwhelmed or unsure about what's happening to someone you care for, stay with me. This video could give you not just answers, but the tools to make every day count. Let's begin. One of the most important indicators is substantial weight loss. One of the early and most visible indicators that someone is approaching the end of a year of their lives is an unintentional loss in weight. It may initially appear to be subtle, like a belt which suddenly requires tightening, or clothes that seem looser, or a sluggish appetite that starts to diminish. Some families believe it's simply a part of aging, however, that losing weight and not trying isn't a sign of good health. It usually indicates that your body is no absorption of nutrients. Effectively, the muscle mass is diminishing as well as the vital systems are slowing. As we age, there is a natural loss of muscle. However, when it occurs too fast, it's an indication that something is going on more. It could be that the body is having difficulty digesting food, and the individual may not be able to digest protein efficiently, leading to muscle loss. The loss of strength does not only make it harder to move, but also raises the likelihood of falling, weaken the immune system, making the person more susceptible to illness. Another factor that causes losing weight in the last year of life is the fact that appetite shifts. Some people who are elderly do not feel as hungry as they did previously. Taste perception diminishes and eating food is no longer appealing, and they may begin to skip meals or consuming smaller portions. It's not just an issue of taste, it's an underlying physiological shift. When the body senses that it's starting to slow down, stops signaling your brain to go for foods as frequently. As a result, a decrease in energy and strength and an aging loss of overall well-being. There's also the impact of the underlying medical condition. The loss of weight is often a sign of chronic illnesses like cancer, kidney disease, or heart failure. All of these conditions can be a long time before evident signs appear. Certain conditions such as depression or cognitive decline could cause a reduction in eating habits and a downward slide that the body's not receiving sufficient fuel to keep it going. Families attempt to address this issue by encouraging their family members to eat healthier and offering food they enjoy, as well as introducing proteins drinks. However, if weight continues to decrease despite all of these measures, it's essential to understand that it's not only diet, but the body's readiness for a more intense transition. When you're at this point, forcing big meals will not work. Instead, focus on food that is comfortable, simple to eat, and drinking plenty of water can make more of a difference to maintaining health and quality of living. If you observe noticeable weight loss in your senior loved one, specifically when they're losing weight and feeling less energetic and struggling to remain physically active, you should be aware. This doesn't just concern the physical appearance. but rather the body's ability to send a message. Being aware of that message right now will aid you in preparing for the future with more clarity, understanding, and the capacity to turn every day memorable. 2. Severe fatigue and weak. A major and obvious variations in the course of the year towards the close of the year is a severe constant fatigue that won't disappear with a rest. The problem isn't simply feeling exhausted after an extended day, it's an extreme exhaustion that causes even basic chores to feel overpowering. When you get up, it becomes difficult, and walking around the floor requires effort, while activities that were once considered regular, such as making dinner, dressing up, or having a chat, begin to become exhausting. This isn't simply a consequence of aging, it's also an indication that your body is storing up its energy. When organ functions begin to decrease, it becomes apparent that the body is making a list of what's important. The heart isn't pumping. Effectively, circulation is less effective and muscles do not receive the amount of oxygen that they used to. This is the reason why many patients in their final years find themselves weak, unstable, and are unable to maintain the level of exercise that they used to enjoy. A second factor that is important is an increase in metabolic rate. The human body is built to create and utilize energy. However, in the process of preparing itself for its last phase, the energy it produces is diverted. Instead of fueling motion, the body is geared towards preservation. That's the reason why someone who is experiencing decline might find themselves taking longer breaks during the day. They may also find it difficult to be in a state of alertness for extended time. Many may have sudden drop in their energy levels and appear fine at one point, but totally exhausted by the following. The most difficult aspect of this is the emotional side of exhaustion. A lot of seniors who used to take pleasure in their independence now find themselves becoming frustrated or embarrassed in the fact that they're unable to perform as they did previously. People may have a tendency to withdraw from conversation or avoid social interaction or even stop participating in activities in no way because they're uninterested. They just lack the passion. This could lead to an unending cycle of loneliness that causes them to stop trying completely, and this only speeds up the decline. If families are watching their loved ones progress from being active with a passion to tired and depressed, it can be a painful experience. You can assume that the person is just lazy or needing to get through it. However, the truth is that pushing them to do something will not aid in reducing the stress. The most important thing is to understand the limits of their body, being able to relax when they want while making the remaining day as relaxing as they can. If you observe a person you know suffering from chronic fatigue that's not alleviated with rest, view it as a signal your body may be through an important change. The time is now to treasure conversations, make peaceful moments, and offer them support without expectation. In the end, the most important thing isn't so you can accomplish, it's feeling valued, respected, and comfortable. If you're reading this video and find these ideas useful, then please leave a second comment below to tell me you've come to this page. If you're not a subscriber already, I'd suggest to sign up and then turn off the sounder so you won't be missing any video. We rely on your help to continue producing quality content that will inform and motivate you. We're moving forward. Third, cognitive confusion or withdrawal. When a person is approaching the point of no return, one of the most noticeable shifts can be observed in their thinking about, communicate, and interact with other people. It is possible to observe the person who used to be focused and intelligent begins to lose track of things more frequently, or struggles with following conversations, or is lost when they are in familiar surroundings. It is possible that they repeat themselves and forget their names or forget their time, even if they had no memory problems prior to. These changes to their cognitive abilities could occur for months or one full year prior to the time of death. These aren't just ordinary memory loss. The brain, as with every organ, requires constant supply of nutrients and oxygen in order for proper functioning. However, as the circulation decreases and the oxygen supply to the brain diminishes, cognition begins to decrease. One may be easily lost, find it difficult to make decisions, or struggling to remember people and locations they've lived with for a long time. In certain instances, there may be short moments of clarity that are followed by sudden bouts of confusion. It's the same as their minds faded out and in. Another sign that is common is the withdrawal of emotions. People nearing the end of their life tends to lose the desire to be social. They may be speaking less, talking less, or for long periods of time being silent. They aren't concerned about the people they love. It's because their brains don't process emotions or engagement in exactly the same way. The conversations become exhausting, noisy surroundings are overwhelming, and eventually a lot of seniors go into their own space. It is also possible to notice change in behavior and mood. Some people become stressed, angry, or just plain frustrated. Some people appear at peace, detached, or aloof to issues which used to be important to them. It's not just a personal change. It's usually caused by the brain adapting to the declining health of the body. With the decline in cognitive functioning, and emotions are more difficult to communicate, and the individual is unable to react to certain situations as they once did. If you have family members in the same situation, this phase can be particularly stressful. The loss of a loved one's contact with reality, or drift away from emotions, may feel like they've been lost even before they're gone. However, it's essential to realize that it's not something they're able to influence. Instead of attempting to get the conversation back, the best thing to do is simply meet the person where they are. Talk gently, give them a reassuring word, and know that even though they might not necessarily respond, they nevertheless feel the presence of your presence. If a friend or loved one becomes more disorganized or confused or less enthused, don't dismiss the signs. This is often a sign that your body and mind are getting ready for the change. It is the time to take your time, enjoy peaceful moments, and work on creating a space which feels comfortable, safe, and calm. Even when the words are gone, the feeling of love and peace remain in the air. Moving on to 4, which is frequent infections and slower recuperation. As your body starts to decline, one of the most obvious physical indicators is the weakening of the immune system. One might observe that a person who was never sick has now been prone to contracting every cold, flu, or any small infected which circulates. Things that were once considered minor ailments now require a lot more time to get over. Injuries that aren't as serious, like a tiny cut wound, heal at a slow rate. The changes don't happen randomly and are a sign that your body has lost the ability to repair or defend itself as effectively as it could. The biggest concern is the recurring infections. Infections such as pneumonia or urinary tract infection, UTIs and skin infections, and oral infections increase when the immune system becomes weaker. Most people think that they are only isolated ailments. However, when they begin to occur often or require a lengthy duration to get rid of in the first place, it's usually a sign that your body has lost its capacity to fight. Antibiotics that once were effective can now appear to be less effective. Patients may require stronger drugs, more time for recovery, and several rounds of treatment to treat ailments that previously would be small. The reason for this is that as the organ's function decreases and circulation decreases, the body isn't responding to treatment similarly. Another issue often ignored is the recurring injuries. If you're noticing that minor scratch marks, wounds, or bruises don't heal properly or are reopening frequently the wound, this may indicate the circulation has been compromised. Insufficient blood flow indicates the nutrients and oxygen don't get into the tissues and skin quickly, making healing slower than normal. Pressure sores, in particular those who are less mobile, can pose a major threat and may result in dangerous infection if not properly treated. And what's worse, in the last years of life, they often do not appear as we'd like. In lieu of having a temperature, a senior might appear more exhausted in comparison to normal, less clear, and less keen on eating. For seniors who are experiencing sudden changes in the level of alertness can be the initial warning signal of an illness, often prior to the onset of other symptoms. That's why being aware of the changes in a timely manner can make an impact on the amount of satisfaction and care they receive during their last stage of the journey. If you have a family member who has their loved ones suffer from frequent infections, it could be a heartbreaking and frustrating experience. It's tempting to insist on extreme treatments in the hope that a second dose of antibiotics or longer hospitalization will solve the issue. At a certain stage, the attention changes from treating to being comfortable, making sure that they are hydrated, maintaining their skin moisturized and clean, while limiting pressure on their bodies can improve their overall health rather than a second dose of medication that just prolongs the pain. If you're watching this video and are finding the tips useful, leave a comment below and inform me that you're watching. If you're not subscribed already, I'd suggest to sign up and turn off the sounder so that you don't lose any video. Thanks for your support. It helps us keep making great content to educate and encourage you. Moving on towards number 5, massive changes in circulation or breathing. One of the clearest indicators that your body is in the process of preparing itself to enter its final phase is an obvious change in circulation and breathing patterns. It is possible that you will observe that your loved one breathes slower or more deeply as they did previously. In certain instances, they could take a breath in between, or their breathing could change, speeding up but then slowing abruptly. Certain people may experience a soft breath pattern known as Cheney-Stokes breathing, in which the breath shifts between intense, rapid breathing as well as lengthy intervals. This can be a gradual change, however, as time passes, they increase in intensity and become more regular. Another sign that is common is the weakening of circulation. It is possible that your feet, hands, or even their noses and ears begin to feel cold and numb to the contact. The skin can appear pale blue, mottled, or bluish, particularly around toes and fingers. It's because your body's priority is to supply blood to organs that are vital and reducing blood flow to extremities. It's an obvious sign that the heart isn't working as well as it did previously. Many people experience shorter breaths when they move a little. Sitting up, talking, or changing positions could result in them feeling tired or lack of breath. It is possible that they breathe through their mouths more often or suddenly have to stop and take their breath when they speak, if they once were in a position to move around the room with ease, and now find it difficult to walk. The lungs' function could be deteriorating. There are times when accumulation of fluid within the lungs could create breathing difficulties. The result can be a chronic cough, grumbling sound, and even a sensation of chest tightness. It's common to think that it's the result of a cold, when in people who are approaching the final stages of their life, this is often an indication your lungs may be becoming weaker. The result is that lying on the floor can be uncomfortable. They may prefer lying propped on cushions or recliner in order to relax their breathing. If you have family members around, these changes could be depressing. Naturally, we want to support, to urge people to slow down and to be worried there's something urgent going on. However, in most cases, this is the body's method of slowing down. It's not always an option to reverse these effects. However, there are strategies to ease them. A cool room with a humidifier or offering small amounts of water may alleviate discomfort. Sometimes medicines and oxygen therapy could help. However, the attention is now shifted to relaxation rather than trying to resolve the issue. If you are experiencing these symptoms, changes in your breathing, cold hands and feet, as well as an eerie blue hue to your skin, pay close attention. These can be signs that your body is trying to conserve the energy it needs and circulation has slowed. It's the time to be active, be reassuring, and help create a space where they can feel at ease and comfortable in these last weeks or months. Most important to them could offer them is not the medical treatment, but rather comfort and dignity, as well as the confidence that they're not on their own. Conclusion. As we approach the final part of this film, take a few moments to think about what you've talked about. Weight loss that is significant, severe tiredness, cognitive decline, frequent infections, and significant changes in circulation and breathing. These 5 indicators typically appear during the months prior to an elderly patient's death. These changes may not occur all in a single day or immediately be apparent. However, once you begin to notice them, they're an indication that your body is in the process of preparing for its last transition. Many families find these transitions can be difficult to take in. Naturally, we want to fight them off and encourage your family member to eat more food, exercise further, or fight fatigue. Sometimes the most effective way to cope is to take note of what the body tells us. Instead of doing everything we can to prevent the process of death, we should concentrate on making the remaining period as relaxing, peaceful, and memorable as we can. Knowing these indicators isn't just about being afraid of death, it's about making sure you are prepared for. If you can recognize the signs in the early stages, you are able to provide higher quality care, take important decisions ahead of time, and make sure that the last days of your loved one are filled with affection and respect. It's a good time to spend time making memories, sharing experiences, and helping them feel loved and are not on their own. If you're witnessing these signals of someone who is close to you, take a deep breath and remind yourself that you're not the only one on this path. Numerous families have been on through this same road before. Even though it's not simple, knowing what to be expecting is a good idea. Find the strength, perseverance, and even peace. Thanks for coming along with this day. We'd like to know what you think. Post a comment and let us know what you've learned and how you're planning to apply it to your daily life. We value your thoughts to us, so don't be afraid to post them. Commenting on your thoughts gives us tremendous motivation and a sense of encouragement. If you liked the video and you found it useful, please follow us on Twitter, and then spread the word. We appreciate your support in producing quality content that will inform and motivate you. Thank you for your time. We look for your participation on the next one.